Hello students, in today's video we will discuss pharmacology of H1 and H2 antihistaminics. This video is third in the series of videos on Autacoids. Now before discussing pharmacology of antihistaminics, it is important to summarize pharmacology of histamine. Histamine is an autacoid, a local hormone which is found stored primarily in the mast cells. Now, histamine is a very well-known mediator of allergic reactions. Now, histamine mediates allergic reactions like allergic rhinitis or the hay fever characterized by runny nose and sneezing. Then allergic conjunctivitis characterized by red, itchy, watery eyes. Then another allergic reaction is the hives, that is allergic skin reaction. Then life-threatening allergic reactions like anaphylaxis characterized by excessive vasodilation that can cause excessive fall in blood pressure and it can further result in coma and it can be fatal also. Now, histamine also plays important physiological roles in the body, like for example, histamine regulates secretion of hydrochloric acid by the parietal cells. Now, histamine in the brain produces wakefulness and regulate cognitive activities like reasoning, learning, then problem solving. Now, tissues rich in histamine are gastrointestinal mucosa, lungs, skin, liver and placenta. Now, the most important primary triggering factors that mediate release of histamine from the mast cells are allergic reactions and tissue injuries. Now, histamine has 4 receptors: H1, H2, H3 and H4. H1 receptors mainly mediate allergic and inflammatory reactions. H2 receptors mediate release of hydrochloric acid from the parietal cells. Now in this video we are going to concentrate on H1 and H2 antihistaminics. Now H1 antihistaminics are used clinically in the management of allergic and inflammatory reactions, whereas H2 antagonists reduce secretion of hydrochloric acid from the parietal cells and are used clinically in the treatment of gastroesophageal reflux disease, gastritis and peptic ulcers. In order to understand pharmacology of H1 and H2 antihistaminics, it's important to summarize pharmacological actions of histamine. Now, as discussed and very important to remember, histamine H1 receptors mediate inflammatory and allergic reactions, while H2 receptors mediate secretion of hydrochloric acid from the gastric parietal cells. Now, let's first see to the action of histamine mediated by H1 histamine receptors. So, H1 histamine receptors mediate inflammatory and allergic reactions. Now, first effect of histamine is on the blood vessels. Now, H1 receptors are present on the endothelium, that is innermost lining of blood vessels. Now, release of histamine by tissue injury or due to allergy, that is antigen-antibody reaction, leads to vasodilation. That is, diameter of blood vessels increase, the blood vessels expands, and this increases the flow of blood to that area, and this results in redness or erythema at the site of injury or at the site of allergy. Now, this vasodilation also reduces blood pressure. Now, further, due to vasodilation, intracellular spaces between the endothelial cells increase, and this is termed as increase in the vascular permeability. Fluid from the blood vessels escapes or passes from the blood vessels into the injured tissue, and accumulation of fluid in the tissues produces swelling. Now, allergic symptoms like erythema or redness of the skin, edema or swelling, inflammation, then red watery eyes seen in the case of allergic conjunctivitis, sneezing and running nose, symptoms of allergic rhinitis, excessive fall in blood pressure and anaphylaxis are all mediated by H1 receptors of histamine. Now, H1 antihistaminics counteract all these actions of histamine and are extremely useful in the management of allergy and inflammation. Further, histamine binds to H1 receptors on bronchial smooth muscles, produce bronchoconstriction, and that causes difficulty in breathing. Another symptom of allergic reactions like anaphylaxis. Now, histamine sensitize H1 receptors on sensory nerve endings in the skin, and this produces pain and pruritus. Pruritus is itching. And these are the symptoms of allergic skin rashes, urticaria, etc. Now, histamine in the brain produces wakefulness and regulate cognitive functioning, all mediated by histamine H1 receptors. Now, histamine H2 receptors are present on the parietal cells in the gastric gland, and stimulation of these H2 receptors mediate secretion of hydrochloric acid from gastric parietal cells. Now, hydrochloric acid is a very important component of gastric juice. H2 antagonists reduce secretion of hydrochloric acid and are useful in the management of gastroesophageal reflux disease, gastritis, and peptic ulcer. Now let's come to the main topic and discuss pharmacology of antihistaminics. Let's first discuss pharmacology of H1 antihistaminics. Let's start with the classification of H1 antihistaminics. Now, H1 antihistaminics are classified as conventional or first generation H1 antihistaminics and newer or second generation H1 antihistaminics. Now, before further classifying these agents, let's see to the major differences between first and the second generation H1 antihistaminics. Now, first generation antihistaminics are lipophilic, that means they are lipid soluble, and they readily cross the blood-brain barrier and counteract or oppose wakefulness and cognitive functioning that is regulated by histamine. And therefore, these H1 antihistaminics produce sedation and cause cognitive and psychomotor impairment. Psychomotor impairment like difficulty in driving and difficulty in performing all other daily motor activities. While second generation H1 antihistaminics exhibit limited penetration of blood-brain barrier. And thus these agents show practically no sedation or minimal, that is very less sedation. Secondly, first generation H1 antihistaminics show poor selectivity of H1 receptors and therefore exhibit varying degree of anti-muscarinic, anti-alpha adrenergic and anti-serotonin action. And due to these properties, they have wide therapeutic spectrum but considerable number of side effects. Now, all second generation antihistaminics are highly selective for histamine H1 receptors, and thus second generation H1 antihistaminics are preferred over first generation H1 antihistaminics in the treatment and management of allergic and inflammatory conditions. Now, coming back to the classification, now we have learned that why first generation H1 antihistaminics produce sedation and second generation H1 antihistaminics are non-sedating or minimally sedative. So, first generation antihistaminics are classified as highly selective agents like diphenhydramine, promethazine, etc. Second category of moderately sedative agents like phenyramine, cyproheptadine, etc. Then mild sedatives like chlorpheniramine, triprolidine, etc. Now, second generation H1 antihistaminics include drugs like fexofenadine, loratadine, cetirizine, levocetirizine, etc. Now, let's discuss mechanism of action of H1 antihistaminics. Now, H1 receptors are G protein coupled receptors. Now look at this figure. This is the H1 receptor. It is a 7 transmembrane G protein coupled receptor. This is 1, 2, 3, 4, 5, 6, 7. So it is a 7 transmembrane G protein coupled receptors. Now H1 antihistaminics are inverse agonist. Now as we all know, histamine binds to H1 receptors and produce pharmacological actions like for example vasodilation, increase in vascular permeability, bronchoconstriction, etc. Now H1 antihistaminics are the agents that bind to H1 receptors and produce pharmacological responses opposite to that of histamine. So H1 antihistaminics are inverse agonist. Now as we know, receptor exists in the two interchangeable conformation. One is the inactive conformation of receptor, another is the active conformation of the receptor. And during the resting stage, an equilibrium exists between the inactive and the active state of the receptor, and this equilibrium is depicted here by the arrows. Now agonist, here the histamine binds preferentially to the active conformation of receptor and shifts the equilibrium towards the active state, and this produces the pharmacological response. While the partial agonist, here H1 antihistaminics, they preferentially bind to the inactive conformation of the receptor and stabilize the receptor in its inactive conformation. They swing the equilibrium towards the inactive conformation of receptor, and this results in the production of pharmacological responses opposite to that of histamine. And thus H1 antihistaminics oppose pharmacological actions of histamine, and therefore H1 antihistaminics are the inverse agonist. Now here I represents the inactive conformation of histamine receptors, histamine H1 receptors, and A represents the active conformation of histamine H1 receptors. Now after summarizing actions of histamine mediated by H1 receptors, now we can easily interpret pharmacological actions of H1 antihistaminics. Now all H1 antihistaminics, that is first generation as well as second generation, produce anti-allergic action. Now as we have already discussed in detail, allergy and inflammation is caused due to release of histamine primarily from the mast cells. So all these agents counteract or prevent vasodilation, increased vascular permeability, then sensitization of nerve endings and bronchoconstriction induced by histamine. Now symptoms of allergy, that is allergic symptoms like erythema, that is redness of the skin, edema, that is swelling, inflammation, then sneezing, runny nose, characteristic feature of allergic rhinitis, then red watery itching eyes seen during allergic conjunctivitis, urticaria, that is skin rashes. All these symptoms are controlled by all, that is first as well as second H1 antihistaminics. Now anaphylactic fall in the blood pressure due to excessive vasodilation is also partially prevented. However, the drug of choice for the management of anaphylactic reaction is adrenaline, because adrenaline is a very potent vasoconstrictor. Now, histamine-induced bronchoconstriction is also blocked by H1 antihistaminics, and thus anti-allergic effects is seen by all H1 antihistaminics. That is, anti-allergic effect is seen by first generation as well as second generation antihistaminics. However, second generation H1 antihistaminics are preferred because they do not produce sedation, cognitive and psychomotor impairment. Now the effect of H1 antihistaminics on central nervous system. Now conventional or the first generation H1 antihistaminics readily penetrate blood-brain barrier and produce variable degree of central nervous system depression, sedation, cognitive and psychomotor impairment. And therefore, patients on first generation antihistaminics are instructed not to drive or to operate machines. On the other hand, second generation antihistaminics show limited or poor passage through the blood-brain barrier, and thus they do not exhibit central nervous system depressant property, and moreover they are either non-sedative or minimally sedative. Now, another very important pharmacological action of H1 antihistaminics is the selectivity for H1 receptors. Now, second generation or newer H1 antihistaminics are highly selective for H1 receptors, while conventional first generation antihistaminics exhibit poor selectivity for H1 receptors. Now, first generation H1 antihistaminics show varying degree of pharmacological actions on other receptors. Now, most of the conventional or the first generation H1 antihistaminics show anti-muscarinic actions. For example, diphenhydramine, phenyramine, dimenhydrinate, promethazine, all these drugs, they show anti-muscarinic action. Now, drug like promethazine blocks alpha adrenergic receptors and show anti-alpha adrenergic action. Then cyproheptadine shows anti-serotonergic action. Now, local anesthetic action is also shown by conventional first generation H1 antihistaminics. Now, however, these drugs are not used clinically. Now, drugs like phenyramine, promethazine, diphenhydramine, they have strong local anesthetic action. Now let's discuss adverse effects of first generation H1 antihistaminics. Now, since second generation H1 antihistaminics do not penetrate blood-brain barrier, they are non-sedative or minimally sedative, and they also do not impair psychomotor performance. And apart from this, second generation H1 antihistaminics are highly selective for H1 receptors and they do not interact with other receptors. Now, conventional first generation antihistaminics show considerable side effects as they rapidly cross blood-brain barrier, and they also show poor selectivity for H1 receptors. Now, these drugs, as they rapidly cross blood-brain barrier, they produce central nervous system depression, sedation, reduced cognitive and neuropsychomotor performance, and therefore patients on first generation H1 antihistaminics are instructed not to drive or to operate the machines. Secondly, most conventional or the first generation H1 antihistaminics also exhibit anti-muscarinic actions, and therefore they show side effects related to these anti-muscarinic actions. Side effects like dryness of mouth, urinary retention and blurred vision. Teratogenic effect in animal is produced by drugs like hydroxyzine, cyclizine and fexofenadine. Then promethazine blocks alpha adrenergic receptor and can cause hypotension, reflex tachycardia. And apart from this, acute overdose of first generation H1 antihistaminics can cause severe central nervous system and cardiac side effects that can be fatal. Now let's discuss uses of H1 antihistaminics. Now all H1 antihistaminics, that is first generation as well as second generation, are indicated in the treatment and management of allergic disorders. Now these drugs control symptoms of allergic rhinitis like sneezing and runny nose. Now in allergic conjunctivitis, these drugs control symptoms of red watery itchy eyes. Then another allergic indication is the allergic skin disorders like urticaria, then dermographism, ectopic eczema. These are all allergic skin conditions. Now these drugs also control acute allergic reactions to drugs, food, etc. Now these drugs are very useful in the treatment and management of allergic disorders. Now, however, as discussed several times, second generation H1 antihistaminics are preferred over first generation H1 antihistaminics. Now, additional therapeutic uses of first generation H1 antihistaminics are seen as they produce varying degree of blockage of muscarinic, alpha-adrenergic and serotonergic receptors. Now, drugs like promethazine, diphenhydramine are used as sedatives for short-term treatment of insomnia. Drugs like promethazine, diphenhydramine, dimenhydrinate, doxylamine block muscarinic receptors, muscarinic as well as histamine H1 receptors located on the vomiting center and exhibit anti-emetic effect. So, these drugs prevent or suppress vomiting. Now, drugs like promethazine or phenadrine exhibit central anticholinergic activity and therefore they are useful in improving symptoms like tremor and rigidity of Parkinsonism. Now, cyproheptadine is an appetite stimulant. Now, some conventional H1 antihistaminics like chlorpheniramine, diphenhydramine, promethazine are added to antitussive or expectorant formulations. These drugs possess no expectorant property but provide relief in cough due to sedative and anticholinergic properties. Now, some drugs like phenyramine, diphenhydramine, promethazine show local anesthetic effect as these drugs exhibit membrane stabilizing property. However, these drugs are not used clinically. So, this is in brief on pharmacology of first and second generation H1 antihistaminics. Now, after discussing H1 antihistaminics, let's discuss in brief pharmacology of H2 antihistaminics. Now, look at this figure of parietal cell. Now, histamine H2 receptors are located on the gastric parietal cell shown here in the yellow color. Now, stimulation of these H2 receptors mediate secretion of hydrochloric acid by the stimulation of proton pump. Now, H2 antihistaminics, they block H2 receptors on the parietal cells and inhibit secretion of hydrochloric acid. So, H2 antihistaminics are H2 antagonist. So, mechanism of action, H2 antihistaminics are H2 antagonist. They block H2 receptors. Now, drugs like cimetidine, ranitidine and roxatidine are competitive H2 antagonist, while famotidine is a non-competitive antagonist of H2 receptors. Now, as we have already discussed, these drugs, they block H2 receptors on gastric parietal cell and inhibit secretion of hydrochloric acid. And therefore, these drugs are indicated in the treatment and management of peptic ulcer, then diseases like gastroesophageal reflux disease. So, this is in brief on the pharmacology of H1 antihistaminics and H2 antagonist. If you find the video useful, kindly like, subscribe and share this video. Now, please note that the information provided in this video is meant exclusively for students from their examination point of view. So, please do not use this information for the clinical purpose and kindly consult your physician for the clinical use of H1 antihistaminics and H2 antagonist. Now, thanks for watching the video.